Hey y'all, welcome to the Kahlani Cheri Show, where no topic is too much, but fabulosity runs wild. Connection to community is top tier.
Turn it up, game time.
From pageantry to boss babe, join me in this new adventure of discussing life-changing topics. You ready? Hey y'all, I am Kahlani Jackson and welcome to the Kahlani Cheri Show. Today we have a special guest with us, no other than Mr. Dr. Quinton Cancel, who is a urologist.
That's right.
He is a husband, a father, and a diggity doctor.
I've been called worse, so it's all good. Yeah.
We're super excited to have you here today.
Glad to be here.
And I guess my first question is, what made you want to go into the urology profession?
Wow, that is a good question. A lot of people ask me that. And really the reason I got into urology was my godfather, who's a urologist. He recently passed, but funny story, we would go over his house during the summertime. I was friends with his son, and we would tease his son like, oh man, we're gonna cover our stuff up when, because your dad's gonna try to check us. And, I was like, I'm never gonna be a dick doctor. I'm not, that's not me. And the crazy thing happened, he exposed me to it. And then when I got to med school, I got to taste test the different specialties, and I found that urology was fascinating. Yeah. The technology, the depth and breadth of what you get to do, and the culture was more fitting with my personality. So I was like, doggone it, I'm a dick doctor now.
Right.
I'll take it.
You'll take it. Cool. So with urology, like it spans kind of across the board. So when I think of urology, I think about like prostate cancer and getting checked for that. But like, what are other things that you do in other areas that you cover?
Yes. Well, oncology, like you said, cancer, prostate cancer, kidney cancer, bladder cancer, penile cancer, testicular cancer. I mean, all the cancers of the genital urinary system. But we also deal with stones. So there's this area is a stone belt. So a lot of kidney stones are formed.
Based off of food. And we're Western North Carolina, by the way.
Yes.
But would that be like food nutrition?
I think it's all the tea that we drink down in the South.
I meant food tea.
But we deal with erectile dysfunction, with low testosterone, which are kind of my favorite topics in urology to talk about. But incontinence, it runs the full gamut of the genital urinary system. So that's vasectomies. Yes, that's right. Give them the snip. So yeah.
Snip. So what brought you here to Asheville?
Wow, I was in private practice for 12 years in Middle Tennessee right when I graduated, and I was getting kind of burned out. We were on call half the month, and so just wanted to change. My kids were getting older, and I felt like they needed a little bigger of a community, a little more diverse community, and so Asheville, we've loved Asheville. I used to actually, crazy story, we lived here briefly when I was in residency.
Oh, okay.
Because when you're at Duke, you do a rotation at the VA here.
Okay.
And so for 6 months, we were across the VA in those houses, and my wife and I just fell in love with Asheville. We're like, man, this place we didn't know it existed. Like the food is great, the culture, the vibe. And so we jumped at the opportunity to come back.
And something that I love about Asheville, but I feel like the mountains hug you. It's really cozy and quaint, and it does like get a lot of people. A lot of people come here to like duck off, reset. It's a breath of fresh air.
It is. It's very
I love it up here. So I kind of want to start getting into some of the juicy stuff.
Okay. So you got the eggplants here.
The lady's like, why are you buying eggplants? I'm like, we'll talk about it later.
Love it.
So why are sex and erections so important to men?
Wow. Sex and erections. I think it's because as men, we grow up socialized thinking, how many girls we can get with, and I mean, that starts at an early age. And so you start to develop this sense of what a man is, and you associate that with sex and how good you are at it or how many girls you can get. And that's very unfortunate that that's how we are socialized. But unfortunately, a lot of us feel like our masculinity and our sense of a man is directly linked to our ability to perform.
Right.
And so when that goes awry, when you start having problems, it really affects your psyche.
Right.
As a man. And so that's why it's important to have conversations. Like, guys, we don't talk about this stuff. So I'm glad that you're bringing this up. But no, we don't sit in the locker room and talk about, hey, how you getting it up? You know, like that is not a conversation that we have. We don't talk about sex, you know, and I say sex is like the only sport that you have that you're expected to like play and be good right away with no training, no expertise, nothing. You just go into it and you're supposed to know.
Yeah.
But it's not that way. And so it is one of these things where I have guys coming into my office and they are demoralized. They feel emasculated because they can no longer get it up and they don't want to talk about it. So their wives think it's something with them and it has nothing to do with them, right? And it affects their relationships, their self-esteem. And so it is so important for us to have these conversations to know what are the causes of erectile dysfunction and how can we fix it? Are there ways through diet and lifestyle that can help? When that fails, then, you know, what are the medications there are so many ways to fix erectile dysfunction. No one has to suffer from it, right? You just need knowledge.
Need knowledge. So what are like some of the things that cause erectile dysfunction?
There are a number of things. There are physical factors.
Okay.
Such as conditions like high blood pressure, diabetes, cholesterol, obesity, things that affect the health of your vessels because you need blood flow to have an erection. Okay, so smoking, things that clog your arteries and preventing blood flow cause erectile dysfunction. There's also hormonal causes. So if your testosterone is low, that can affect your ability to have an erection. If mentally you have some issues, trauma or performance anxiety. We could talk about that because that's real. No, I mean, but it is a thing where a guy can psych himself out of a good erection, and so you know mentally you have to be there. So there's psychological factors. There are medications that can cause erectile dysfunction as well. Some people who've had surgery, particularly prostate cancer surgery, can develop erectile dysfunction. So there are a number of physiologic causes, there's psychological causes, hormonal causes of ED.
So as far as like food, right? Like, you know, talking about the food and different things can clog the vessels. So I feel like all you hot girls out there feeding your man, quit giving them fried stuff, right?
No, for sure.
Yeah, so like fried foods, what else?
Fried, processed foods, sugar, dairy, anything that causes inflammation and builds up free radicals. We talk about free radicals, and that's where fried food comes into place, right? Because free radicals are like these unstable oxygen species that go around and they try to steal electrons from your DNA, from your cells, from your protein, and they make things unstable. But they can also steal electrons from your blood vessels, causing damage to your blood vessels. Wow. And so the more fried foods that you eat, the more damage you cause to your, and junk food.
Messing up your sexual health.
Exactly. It doesn't happen immediately.
But it's a slow.
But over time, if you continue to have a poor diet, it will eventually catch up to you. And it leads to other conditions that cause erectile dysfunction, like the high blood pressure, high cholesterol, diabetes, obesity. Yeah. So stay away from fried foods, but the best foods to eat are whole foods. Okay. And actually, I'm not there yet, but the best diet is a plant-based diet for erectile dysfunction. Yeah, studies show that men who have a plant-based diet have less erectile dysfunction than men who have a primary meat diet. Ooh. Yeah.
Y'all better get y'all veggies. So, Let's see. What is another question? What led you to? What are some? Okay, so we'll talk about the mental health aspect, right? Are there times where like people will come in and they'll say, "I've dealt with sexual trauma," or "I'm having anxiety," and you send them to a psychologist or counselor? Like, how does that look? Because I am always for mental health.
Yes.
I feel like we don't talk about it enough in the community, and usually like something that's gone on that kind of sits on you, it turns into anxiety.
Yes.
So it's better to kind of talk about it.
Yes. Yeah.
And it's a ton of people that are dealing with things. So go get you a therapist.
Yes. No, mental health is so important. You know, they say 90% of sex is in your mind, right?
Oh, wow.
And so when you have had trauma, and, you know, I have this theory that all men have had some sexual trauma in their lives at some point. And what I mean by that is not necessarily every man has been sexually abused, although some have. They maybe didn't call it abuse or didn't think it was abuse, but maybe there was some older girl in the community that was, you know, messing with them and, you know, kind of, you know, they thought they were the man, you know, but exposing them to things too early, you know, and then they develop this attachment. I've seen it. And I've seen when you don't deal with that kind of trauma, it affects your relationship because as a young child, a boy, you're dealing with your first sense of intimacy is actually through abuse. That can skew your view of intimacy and affect you in a long-term relationship, in a marriage relationship. But also, you know, porn is huge, right? It's a big it's a big problem, you know, that, you know, many men we suffer from. And why I say that's traumatic is that a lot of us were exposed to porn early in growing up. And, you know, when you're a young child, an adolescent, you don't know how to process those images that you see. And then our education is like actors that, you know, it's not real, but we're trying to recreate things. And so it skews our view of what sex and intimacy really is in a loving relationship. And so that is something that we have to rewire in our brains and know that, you know, this is not real. You know, and the expectations we put on women are not real, right? And most of porn is so focused on men's pleasure, right? That, you know, we forget, you know, there's another half over here, you know, that we as men need to be educated how women's bodies work, you know, what's pleasurable for them. And so I think porn really does us a disservice in a lot of ways. But then you have the mental aspect of performance anxiety. When you are afraid that you're not going to be able to keep an erection, you're not going to be able to get it up, it actually is a self-fulfilling prophecy. Because what happens is that your nervous system kicks in. And this, I'm giving you a little science here.
Keep going. I love it.
So, you know, you have a sympathetic nervous system and a parasympathetic nervous system. Okay. Your parasympathetic nervous system is your feed and breathe nervous system. That's the one that's, you know, when you're eating, your blood flows into your gut and your internal organs to digest it. Or when you're intimate, blood flows to your pelvis. And, you know, it's sort of when you're relaxed, right?
Right.
Your sympathetic nervous system is your fight or flight nervous system. That's when you get anxious and, okay, there's a bear, I need to run.
Yeah.
You know? And so what happens is that physiologically your blood flows actually goes away from your internal organs and goes to your limbs so you can fight or flight. So guess what? If you are anxious about having sex or with your erections, blood is going to leave where it needs to go and go elsewhere, right? The crazy thing about it is that our nervous system has not evolved. Right. It can't tell the difference between running from a lion or a bear or my fear of being successful in the bedroom. So it's the same response. Okay. So you're having the same response of I'm getting chased by a tiger when you feel like you're not going to have an erection.
From the cat.
Right. Yeah.
Okay.
That's funny. But but that's real. So guys need to know that because you can psych yourself out. Right. And the more that you avoid sex because you're afraid of failure, the worse that condition gets. Right. So the best thing to do is just relax. I know that's easier said than done.
But like when you're in an intimate space, it's like lights, camera, action. You got to make sure you're on point. But I could see that would be like debilitating as well.
Well,
to
if
have
you're
that much pressure.
yes.
And then think about like how many people like are promiscuous, maybe, well, it's everybody grown, but like a one night stand or something like to go in, that's a lot of pressure.
Well, when you said lights, camera, action, you know that the idea is performance.
Yeah.
Right? Your performance. And so when you're looking at performance and you're focused on performance, you're actually missing the intimacy, the experience, what feels good. And so for couples that struggle with this, I recommend just take the pressure off. You know, guys we don't want to tell our significant others we're having problems, but guess what? Y'all know anyway, right?
Right.
It's not.
That's true.
Right? So the best thing you can do is work together. And instead of intercourse being the end all be all to your sexual experience, enjoy the experience. Enjoy, because there are many ways to have sex without intercourse, right? And so when that pressure is taken off that I have to perform, your body responds better.
And I think kind of overall thing is just like the mental aspect. Like you have to build intimacy, but in different ways that isn't just intercourse. You know what I mean? So like the couples therapy, like doing more things together where you feel connected without having to.
The crazy thing about it is that I think for men, that's the only way we really know how to feel intimate is through sex.
That's beat up.
It's messed up.
That's messed up.
But we're not used to being intimate though. We're not used to like, hey, how was your day? And, you know, like really talking and really, you know, we just don't, we're not wired that way. Now we can.
Women love that. So ask, how was your day, boo? Ask us questions.
It is.
I love it,
it's important. And so if men knew, those are the hacks to get, you know, so I always say we stop at trying to penetrate our women's bodies. We need to penetrate their minds, right? We need to get into, how are you doing? You know, like, how was your day? What's bothering you right now? You know, because that's foreplay to y'all, right? Right? That's like, wow, he. But
do you feel like that's the same for men?
Absolutely. Absolutely. I feel like when a man is recognized and for what he's doing, not for what he's not doing, when he's respected, when he's appreciated, when he feels desired, because we want women to say, hey, I want you. You know, you look good. Like, baby, you looking good. Like, we like to hear that too. We like to feel desire. If we're the ones always pursuing, always initiating, always and we're not getting it back, you know, it drains us. So men like that too.
Period.
Yeah.
All right. So, what led you? So we're about to go into our next phase, you guys. So what led you into developing a male enhancement? And can we talk about that?
Yes.
Supplement.
Yes,
supplement.
So I'm really big into diet and lifestyle.
Okay.
Right? I feel like most of the issues dealing with erectile dysfunction can be fixed through diet and lifestyle. All right. So I'm always going to advocate eat healthy.
Okay.
Eat whole foods. Thank you. Eat plant-based foods.
Okay.
But I realized maybe that's not realistic for everybody every day, right? You're not going to eat a salad every day. Maybe you will, but that's good. That's what I encourage, but not everybody's going to do that. And so what happens if you're not getting that good fuel that you need to perform? Well, that's where supplements come in. Okay. And so I talk about watermelon, you know, as a source of citrulline, which is a nitric oxide precursor. So I was like,
In lamer terms, what does that mean?
Okay. So you have amino acids, which are building blocks for proteins that lead to what we call nitric oxide, which is a gas that is actually the way Viagra works, right? Because when that gas gets into your system, it causes expansion of your blood vessels to increase blood flow. That's the name of the game. And so I said, if I'm going to put together a supplement, I'm going to have it full of nitric oxide boosters. So I've got beets, I've got kale, which are natural nitric oxide boosters. but I also have amino acid precursors, citrulline, again found in watermelon, arginine, which is another amino acid, which is found in nuts. Okay. I have stuff for libido, maca root, Korean ginseng, fertility. It helps with that as well. But I also have some testosterone boosters in there. So I've got trace minerals, boron and selenium that increase testosterone, free testosterone in your body. But as a urologist, I know men, as they get older, their prostates are an issue, become an issue. They become enlarged. So I have things for prostate health in here as well. Saw palmetto, which incidentally helps women with their skin. Okay. But pumpkin seed and flax seed. Okay. I have a bunch of antioxidants in here. Now, we were talking off camera about how antioxidants actually slow down the aging process, right? By cleaning up those free radicals. So it helps everything, all your cells, your blood vessels, your DNA become more stable and healthy to help prevent cancer and inflammation, right? So all of that's in here.
Everything in one bang. Like,
I try to think of every single thing. I've got ashwagandha in there, which is an adaptogen that helps with stress response, immune system, vitamin C, zinc, but it's got natural energy in here too, B12 and green tea.
And I love it too, because like sometimes it is hard to be like, okay, I'm going to eat vegetarian, be vegan.
Yes.
So this is just like, just add it in with what
Just add it in. I will say this. A supplement is not a silver bullet, meaning you can't eat burgers and fries every day and take a supplement and think that everything is going to be okay, right? This is for people who are wanting to have a healthier lifestyle and wanting to eat better, but maybe can't all the time, but want to still get those nutrients in. So I developed Naturally Man. I brought
called Naturally
Natural E Man.
Okay.
And so Natural-E Man. And so the E, and I put it on the bottle. It stands for enhancement. So that's talking about the blood flow energy. We talked about the green tea and the B12, and edge with the testosterone, the immune support, the stress adaptogens in here. So I have it in a nice watermelon flavor.
Nice.
My wife actually takes it. And so there's nothing that women can't take, but I am developing a women's supplement too called Naturally Her. So I brought samples of both that I'd like for you to try.
Yeah, I like samples.
This one is actually the Naturally Man. We let your mom taste a little bit of it here too. So this one is the
This ain't gonna have me growing chin.
No.
Okay.
No, my wife takes it. She's runs every day.
Good. Period.
Yes, thank you. Yes. It's crazy because it's so healthy for you, but it tastes.
No, that has a really good, because some supplements are trash.
Yes.
This is really good.
It tastes well, thank you. It's better with ice and cold, but
but I mean, by itself, this is good though.
you can drink that. So I don't know if you work out. You look like you work out. So
A little Ozempic, but we'll talk about that in another episode.
but yeah, that can we use it as a pre-workout.
Okay,
For
cool.
workout. It gives us the energy and I.
Well, this is good because I would like do this with a smoothie, but even just by itself, that's pretty. That's legit.
Thank you. Now I have the other
In this back.
the other supplement. So this is Naturally
So that
Her.
was watermelon.
This is
I
watermelon.
really like that. You might need to make a women's and watermelon too.
Yes, well, I actually got one watermelon raspberry that I'm coming out to, which is even better than this. So this one is Naturally Her. It's a prototype. I'm still in development, but I have a sample here. This is peach mango. Okay. Now this has everything that has in it. Plus it's got biotin. It's got collagen in it for skin, hair, nails. It's got cranberry extract for UTI prophylaxis.
Okay.
Does
it have anything for like female wetness?
Well, so when you're talking about, so we all have the same pelvis essentially, right?
Okay.
And so when you're talking about, vaginal dryness or wetness, some of that is hormonal, but some of that is just getting good blood flow down there. And so just how this helps with blood flow, it helps women, it can help with women with blood flow down there as well. Okay. So try this. Tell me what you think.
That other one was good. I don't know if they can top it. This is good.
It kind of hits a little later too. Yeah, that mango.
Yeah, this is good.
Good.
I can rock with this too.
Good. Yes.
This is giving tea. This is giving like tea kind of.
Well, it does have green tea.
Oh,
Yes, it does have the green tea, and so that's the energy. And so I would say if you're caffeine sensitive, take it in the morning.
Now this is good too. This hit too.
Yeah.
Yeah.
Good.
All right, so
Good,
this
you like
is
it. Naturally Man, and the women's version, which hopefully will come out in the fall, is Naturally Her.
Naturally Her. All right, I can keep that one.
Yes.
We gonna sip on that.
Nice.
All right. Oh, good. So, a question that I have, like, you'll see on Instagram and different places, they'll have like the honey packs. You go to the gas station, it's like men erectile pill. Do you recommend that? Or should people kind of shy away and go to their healthcare providers?
Yeah. So,
Because, you know, some people want like a quick fix, but it's like, what's the long term?
there's a lot of snake oil out there. There's a
Snake oil.
Yeah, I mean, like, God, I think, that people know that this is an issue for men. Men want to get erections, and they will get dick pills from a gas station or powders or whatever. And, that's this industry is not regulated. So none of this stuff is FDA approved or studied.
At the gas station?
Yes. And so you're kind of,
Y'all better quit playing with gas station pills.
you're taking your chances, but every ingredient here has been studied, and has shown in scientific papers to improve the things that it's supposed to improve. So, you can take your chances with, gas station pills, or you could take something that was developed and curated by a board certified urologist.
Period. All right. That makes sense. Okay. So, are there exercises that people can do to increase testosterone and improve stamina in bed?
Yep.
And preventing premature ejaculation?
Okay. So,
What do we need to be doing? Yeah, that was real loaded. What do we need to, or what do men need to do to kind of help, like exercises to get the blood flowing?
yes.
And
So I don't recommend as much cardio, although you do need blood flow. But when you're talking about raising T levels, it really is about muscles, right? And using weights and resistance, okay? So the more muscle that you work, the muscle actually releases testosterone into your bloodstream when it's worked, right? And so that way you actually build muscle and lose fat. Now, fat is our enemy as men, because in fat,
as women too, I don't want no fat. Except for my butt, I don't want no fat. Sure, there, that's it.
but for men, in fat, you have something called an enzyme called aromatase, which actually can convert testosterone to estrogen. And that's found in the adipose tissue. And so,
Yeah, I don't need estrogen.
no, but every man has a little estrogen, but when those levels are abnormally high, it can throw off your testosterone.
Okay.
Okay. And so that's why doing weight work is so important, because you burn the fat quicker and build muscle mass, which you're increasing your testosterone and lowering your estrogen levels. Okay. Now, there are exercises that could help with stamina in the bed. And women know about them. Men don't know about them as much because they're called Kegel exercises, right? You guys
at the red light.
Kegel exercises. But our pelvic muscles are weak because we don't work on them. As men. We don't, there's not a need to. We don't usually have urinary incontinence. We don't have babies, we don't leak, that kind of thing, right? I know, y'all are great. But glad we don't have to go through that. But as a result of that, our pelvic muscles aren't as strong. And so when it comes to ejaculatory control, those are the muscles that need to be strengthened in order to be able to hold. Okay. And so I tell men, when they're doing Kegel exercise, you have fast twitch muscles and slow twitch muscles. And you have to practice both in order for it to work. Your fast twitch or your power muscle, that's your power. And so that's those quick thrusts. So when you
that stops urine.
Yes. So that's a good way to explain what a Kegel exercise does. Is basically that muscle that you use to stop your stream. That's the muscle that you need to focus on. And so when you're looking for the power part of that muscle group, you need to do quick contractions, like 10. contractions and do that 6 times a day. For
At every red light.
or every commercial, or if you're, you can do it sitting down, watching TV, laying in bed. But then your slow twitch muscles are your endurance muscles. Okay. So that's when you got to squeeze and hold. Okay. At about 80%, not full strength. So where that comes into play is that for incontinence, let's say, before you stand up, because some people leap when they stand up, you want to squeeze, so you want to turn on that power, right? And then you want to use your slow twitch fibers, which are your endurance fibers, to hold, okay? And so you have muscle that's around the bulb of your penis, okay, that's connected to your pelvic muscles,
Okay.
that you can actually learn how to squeeze. And then actually, when that muscle gets strengthened, your ejaculations will be stronger too, okay? But the premature ejaculation also has to do with the nervous system, okay? Because it's the sympathetic nervous system that is responsible for emission or ejaculation. It's the parasympathetic that's responsible for erections, okay? So think about this.
That's 2 systems going. That's a lot.
They're systems, but when they're activated, they lead to different results, right? So as long as you are relaxed, and you're out of your head about things, you will probably last longer than if you're anxious and tense. Okay, because that sympathetic nervous system is making you ejaculate quicker. There's another thing that I talk to men about, and that is training. Okay, because it sounds kind of silly, training to have sex, but
I think that makes sense.
okay, good.
I think that makes sense. Yeah, because it shouldn't be like a wham, bam, thank you, ma'am. It's kind of like a marathon, like a sprint, like it.
You have to. You can't just expect to run a marathon in practice, right? And so you have to condition your body, right? And so for men, growing up, guys, masturbate. And we're just trying to get one off, right? I mean, that's the goal, right? To get off. It's not to learn how to last longer. It's not to learn how to know your body, what's more sensitive, what's less sensitive.
And I hear like there's a rapper, Kevin Gates, and he talks about semen retention. So that's kind of...
Well, that's something a little different.
Okay.
That's purposefully not ejaculating, for weeks, just, for energy, for focus, that sort of thing. But when you're talking about in the act, if you're trying to resist ejaculating early, a lot of men feel like they don't have good ejaculatory control. And again, that's because you're not practicing right. But there is something called edging.
Okay.
That I recommend men do.
What is edging?
So edging is getting to the point before you have an orgasm and then backing down. Okay, so being stimulated. But guys we know like, okay, if I do 2 more strokes, I'm out. Like, we know this. And so before you get to that point, stop.
Okay.
Okay, pause.
And then the benefits of that is just longer.
Yes, you're actually training your body to, because if you can just breathe through that and relax, you actually can go longer.
So what can women do to help their man edge and not be doing the most?
That is great. That's a great question. That's a great question, because I feel like there's a role for women in this, but there's also a role for men, right? So I feel like men, if you masturbate, do it with a purpose. Okay. Do it with the purpose of, I want to gain more ejaculatory control. Okay. But also when you're with your partner, if you know that that's an issue, and I know people who have had lifelong premature ejaculation, like they can't go over a minute their whole lives.
Wow.
Okay. And so that's where the partner comes in and say, okay, this is a concern. Like, this is where you got to say, hey, this is a concern for me. Like, I want to go longer. I want to last longer. You can help. And so when y'all are playing around, fooling around, foreplay, work with them. Basically, when he's about to get to that point, stop. Do something else.
Get off the pony.
Come back. Right. Do something else that's sensual,
Right.
and then come back, and it's not overnight. It takes training to do that, but you can build stamina over time.
And I feel like an overall thing, I guess, that I'm hearing as like a woman, and like being maybe a better lover, but like cutting the expectations.
Mm-hmm.
Because now, like, I know that women, like, they have an expectation of how things need to go, right? But
So do men.
But men do too. So it's kind of unfair on both parts. So just kind of going in like, whatever it's going to be is a lot better. And maybe communicating more.
Yes.
So that your partner knows like where you're at.
That's key.
This could be, I don't know, like sex, like when you talk about, you know, you get red and rosy in the cheeks. I'm like, oh my gosh. But it shouldn't be like that. It should just be a good thought out conversation.
Yes. It's too important of a topic.
Right.
To leave to chance, right? And to not talk about it. It's hard because we're conditioned, you know, maybe with religious backgrounds or whatever, not to talk about it. But God created it, right? It's natural.
And we need it.
And we need it.
We need more babies. Future doctors and scientists and presidents. So we need sex.
But communication, studies have shown that the more you communicate, the higher your sexual satisfaction is just by communicating about sex, right? But that's something that, you know, men and women can start doing. Sometimes women don't want to communicate with men because they don't want to offend them, like, you know, you're hitting it right or whatever, right? But there's tactful ways of saying that.
Yeah.
But as men, this is where we need to educate more men on.
Right.
Because you know, our number one sense of pleasure is with intercourse. But studies have shown that's not women's favorite.
It's not.
Right? And so that's something that I don't know if your viewers even know this, but men, you know, vaginal penetration is not the most pleasurable form of pleasure for women. That's because of your anatomy.
Again.
Vaginal penetration. But it's your anatomy, right? Because what's the most sensitive part of your body is the clitoris.
Right.
Right? And so if that's not being stimulated in some way, you're not going to have the same amount of pleasure or greater pleasure. Okay. So men need to understand that and say, hey, it's not, I mean, you back there thinking you're wearing it out, you know,
it's not.
And it's not right. And so that's why the whole thing about size and this and that, you know, it matters to a point.
But then it doesn't.
But then it doesn't. It's more of your technique and your approach. And so if we as men understood women's anatomy more and what causes you pleasure, it would take more pressure off of us.
Maybe you should teach a class on like anatomy because everybody's different. And something that I hate is like in textbooks, I feel like they only showed like maybe 1 or 2 vaginas, right? So then in your mind, you think that everything looks one way.
Yes.
And that's not reality. No. And even with like men and their penis sizes, it's different shapes.
Correct. It's all different, but it's all different, but it's all the same in a sense that, you know, for men, the most sensitive part of their penis is the glans, the head of the penis, which is analogous to the clitoris in a woman. Okay, it's the same structure. Women have erectile tissue. Women have multiple bodies. You know, a lot of women don't even know their own anatomy internally, you know, but there are, you have erectile bodies that go towards the clitoris. Okay. So there's so many parts of the vagina that are sensitive, right? It's all like, if my advice to a man would, you know, be to explore your woman, you know, don't just go for the clitoris right away, you know, like just do various things because there's so many, and it's not just about vaginal touch. It's about other touches. You know, you just got to change it up. If you're coming through the hole the same way,
teaching a class. Y'all, Dr. Cancel, you teaching a class.
Well, I mean, we can have another topic on this, but it's important because again, it's too vital to a relationship and to our sense of well-being to not get this right. Right. And so to have these honest conversations about it and to not be offended. If you're a man, don't be offended. Just learn, educate yourself.
Okay, so a man during intercourse just kind of randomly going soft and losing his erection. Does it have to deal with the female, how he views the female? Is it just a woof, this just happened out of nowhere? Is it a mental thing? Like what causes a man to lose his erection mid-intercourse?
It could be a number of factors. It could be, you know, if for some reason he is in his head
Okay.
and feels like I'm not going to keep this, then like we talked about, it will go down, right? And so as men get older, sometimes you need more stimulation. And so, that's where you have to explore what position is more stimulatory for me, that's, going to get me, where I need to be, right? And also, if a man thinks that, as women get older, sometimes the sensation is not the same for women, perimenopausal, right? And, sometimes it hurts. And for men, if they see that they're hurting their partner, or they're not seeing pleasure in it, that could be a downer. So there are multiple factors. If there's not enough lubrication, it could hurt.
So how is spirituality and intimacy related?
This is something that a lot of people don't realize, that sexuality and spirituality are related. And so when I approach erectile dysfunction, I do it holistically.
Okay.
Right. So we talked about the physical. We talked about the mental. Let's talk about the spiritual. Okay. Because every sexual desire comes from a spiritual place. And what I mean by that is the desire to be loved, the desire to be known, the desire to be accepted, to be received. These are all real human desires. It's just that men, we feel like we can only express them through sex or through intercourse in particular, right? But there's a lot to that, the spiritual part of it, and that I feel like if we don't really address that, it can affect our ability to be intimate. We are spiritual beings as well, right? And if we are not spiritually healthy or spiritually aligned, it really affects who we are, our view of ourselves.
Dr. Cancel.
But it also affects our ability. I can't connect with you spiritually if I'm not intact spiritually, And when you're talking about trying to have that deeper connection, that spiritual connection, that's lost if that part is not developed. And so I don't want men to just think it's just my penis, it's just my erections. No, it's it's your mental health and it's your spiritual health.
That's good.
Thank you.
Real good. Real good stuff. So is there a correlation between the number of ejaculations and prostate cancer?
Yes, actually.
Okay.
There's actually a very well known study at Harvard that looked at men who ejaculated a certain number of times a month, and they saw that there was a correlation between number of ejaculations and prostate cancer. And so men who ejaculated at least 21 times a month had a over 30% reduction in the incidence of prostate cancer.
So more ejaculation means less.
Less chances of prostate cancer.
All right.
Yeah. So women, you can help stuff out prostate cancer.
Yeah.
I don't know when this is airing, but November, prostate cancer awareness month. Yeah.
Oh, okay.
Yeah.
November.
Yeah.
Okay. And then something else, I feel like we don't talk about this at all, but vasectomies. So if y'all don't know, I'm a birth and doula as well. So I deliver babies here in Western North Carolina, but we have a lot of moms that go and they get, their tubes tied and it's a whole thing. They get put to sleep, but a vasectomy might be a quicker, it's less downtime procedure. So can we talk about that?
Yeah. So vasectomies are great. I perform them routinely.
Okay.
And I can do them in about 10 minutes. So it's pretty quick.
10 minutes, y'all.
That's not everybody, but I can do it in 10 minutes. And it usually takes maybe 15 to 20 on average. But basically, it's a very simple office procedure. At least I don't even make an incision. I use a no scalpel technique. And so that's basically after the skin is numbed up in the middle of the scrotum, we just make a little prick and open it up. open up the skin. And then we just cut a segment out of the vas deferens, and put clips, burn, and then tuck it back in. Do the same thing for the other side. And literally, you're in and out of the office in maybe 20 minutes total.
So what is the downtime like? Are men down for a week? Are they down for 2 days?
Yeah, I recommend rest for 48 hours afterwards. So just, lay low, kick your feet up.
Lay low.
Yes. I mean, just don't do too much. I had a vasectomy and I didn't follow my own advice. And so I went to Walmart or something and I was like, I kind of felt sore, you feel like that, like you got kicked a little bit. So I definitely want to recommend letting yourself heal, but there's also 2 weeks of abstinence afterwards. So be prepared for that, men. So we don't
get your vasectomy, 2 weeks abstinent.
No. After your vasectomy, you need to not ejaculate for 2 weeks afterwards.
Okay.
To allow things to heal. Okay. And then afterwards, and here's the thing, a lot of people feel like if I have a vasectomy, it's going to affect my erections, or if I have it's going to hurt when I have an ejaculation. None of this is true. Okay, you don't feel like you got blue balls, or you don't feel backed up. Most of the fluid you'll still see fluid coming out when you ejaculate, because most of the fluid comes from something called the seminal vesicles, which are these organs that sit behind the bladder that produce semen.
Okay.
Okay, and they join up with the sperm that comes from the testicles and ejaculate through the prostate. And so you'll still see fluid, just over time, it won't have sperm in it.
Okay. Is there a window though? Like after you wait your 2 weeks, you still shouldn't do it because,
Oh,
when you
yeah.
get pregnant,
Yes.
like it's still swimmers.
Yes. They're still swimmers. So this is a really good point. You're not sterile right away after a vasectomy. Okay. The vas deferens is about 18 inches long. Like it's a long tubular structure. Okay. And so you still have sperm in the pipeline beyond where you cut. Okay. So that still needs to be released. Okay. So we recommend 20 to 30 ejaculations after with protection after a vasectomy in order to clear the pipes. Okay. And then we bring you back in about 2 months later, 2 months after the vasectomy, do a semen analysis. So you are not clear unless you have an analysis that shows 0 sperm.
And then another question, what is a good candidate and what is a bad candidate for a vasectomy? Like, who would you be like, hey, I kind of really want you to think about this. Are you sure about this?
Yeah, I used to, oh my goodness, I had, after the decision by the Supreme Court to reverse Roe v. Wade, I had guys coming in my office, young men, no kids, not married, wanting a vasectomy. And, when that's the case, I do counsel them like, this is meant to be permanent. There's not just do it now, then I have my fun. And then 10 years later, get it reversed. There's no guarantee that it's going to work, right? If you do that. I did have a guy he was 18 and he came in and he was like, and normally I don't judge. If that's what you want. But I just said, man, I want you to think about it first, because you have a whole lot of your life left to live.
Right.
What if you find someone that wants to have kids? Well, we'll just adopt. Well, what if she wants your kids? And so I was pretty happy that he changed his mind. But yeah, so I do have problems with really young men coming in and wanting a vasectomy, not truly understanding what that means.
Dr. Cancel, women can go get a BBL, they can go get a breast augmentation. Can men, can they get a bigger size? Is that a thing?
There are things that...
Is it worth it?
That's a great question. I think men have body dysmorphic disorder when it comes to their penis, honestly, because if you think about anatomy, again, the average length of a vagina is about 3.5 inches on average. The average length of an erect penis on average is like 5.5, 6 inches. And so by the math, things should work out, right? However, I think because of our porn culture,
and then tore everybody up.
It's messing everybody up. We're comparing ourselves to people that are outside of the norms. But So there are ways to enhance things. There's simple ways you can enhance. Number one, just getting better blood flow.
Right.
It's a dynamic organ. So if you have better blood flow, you'll have a larger erection. Losing weight. Okay. A lot of men who are a little bit more portly or a little more weight actually can develop more of a buried penis. Okay. So it's there. You just don't see it because of all the fat. Right. So losing body fat can actually increase the look. Right. Shaving. A lot of guys shave to help improve the look. Yes. Yeah. So that's another way to visually enhance things. Implants. There are implants for men. They're not really made like a breast implant, though, to make things bigger. We measure you out, and what you have is what we give you as far as the length of the prosthetic.
But does sex still kind of feel the same?
It feels the same, yeah.
Oh.
Yeah, it's.
I would be afraid to mess with like my anatomy and then something not work.
There's the risk of mechanical failure, but the sensation's intact. You have an orgasm. You just don't go down afterwards. You have to hit a release valve to release it for it to go down after.
That's like Inspector Gadget.
Yeah, that's some Bionic Man stuff right there. Yeah.
Iron Man. Oh, cool.
But there's a way to cosmetically you can cut something called the suspensory ligament that connects the pubic bone to the penis. That will drop the appearance of the penis. It'll drop it down, but it also affects your ability to have an upward erection. And it doesn't increase length as far as erectile length. So it's just a cosmetic thing. If you want to walk around the locker room looking like you're longer, you can, but I wouldn't recommend that. There's some other things out there that are not really mainstream. You hear about collagen or, and fillers, that sort of thing. I would steer clear of all of that.
Yeah.
Honestly. Yeah.
All right. So it's time for a round of this or that.
Okay.
All right. Sex pistol or one-eyed dragon?
What'd you say? Sex pistol, one-eyed dragon.
So it's this or that. It's going to be rapid fire. This or
I
that.
don't even know what that is.
Wiener or phallus?
Phallus.
Jim Dog or Johnson?
Johnson.
Dick or cock?
Dick.
Peter or Pecker?
Peter.
Wheelie or Wood?
Wood.
All right. You survived. All right. Well, Dr. Cancel, thank you so much for being here on the Kahlani Cheri Show. How can our viewers reach you?
So I'm on social media at Ask Dr. Q MD. So on IG, Facebook, TikTok, YouTube. You can get my supplement at naturaleman.com, and that'll take you to the website to purchase the supplement.
All right. Thank you so much.
Thank you.